as important that we monitor the child's growth. And in order to establish meaningful data on the longitudinal growth of your child, it is recommended that the children need to have assessment and a weight, height, head circumference checked throughout the years up until 2 years old, more regularly, and then typically about 6 monthly or yearly after that. And so it is important that you visit your pediatricians on a regular basis, at different stages of their life before 2 years old, and not just wait until your baby is sick to visit your pediatrician. So this is a guideline to show of your child's growth projection. So in terms of linear growth, we expect a child to grow by about 25 centimeter in the first year, 10 to 12 centimeter second year, and double the birth height by the time the child is 5 years of age. And in terms of weight gain, the child is expected to double their weight by 4 months of age, triple by 12 months, and gaining about 2.25 kg per year to about 5 years of age. If your baby is growing according to this projection, it's great. However, if your baby is not growing as much, and even much so very little according to this projection, then your baby may be having growth altering. And in the next few slides, I'm going to show you examples of what I mean by growth altering. So this is a, you can see 3 graphs here, and this is each chart of this shows a weight percentile, length percentile, and head circumference percentile of your child. And the x-axis is the age, and the y-axis is weight, height, and head circumference. As you can see here, there is a proportional decrease in weight, okay, as well as the length percentile, sparing the head circumference percentile. And we see this commonly in patients who have psychosocial deprivation. We see this in patients who have endocrine problems and or bone disease. Fortunately, being a general pediatrician, I don't see this in my clinic often because I don't see endocrine problems. Endocrine problems, I would say, is very rare in, quite rare in children. But the next slide is a growth chart that I see often in my clinic. And this is when there is a weight reduction and just a slight length reduction, and again, sparing the head circumference. It is very uncommon for you to see a reduction in head circumference. If you see head circumference reduction, that means it's more of a big issue. It's affecting the central nervous system. And when do you see this kind of chart? Typically in a child who is malnourished, okay? For example, if the child is breastfeeding, and if the child has ineffective breastfeeding, meaning that the mom is not producing enough breast milk, the baby may be growing well initially and then starting to drop, okay? And so this is the time when we need to intervene. And second scenario, when you see this growth chart, is when a child has some kind of infection causing them to not eat as much and therefore falling in their weight percentile. The other scenario is you're feeding your child infant's formula or breast milk, but you are slow to introduce complementary food to your babies, and therefore there is a drop in the weight percentile. So I see this, I think this is the growth chart that I see most common in my general pediatrician clinic. And lastly is when you see here, there is a proportional reduction in weight, height, and head circumference. And this is very rarely seen in my clinic. As I mentioned, when the head circumference percentile starts to drop, it means that there is some involvement in the central nervous system. So you see this in someone who's got a brain issue, and at which time usually this is definitely leading to developmental delay, and also someone who's got a hormonal issue as well.